Hello everybody, I am Dr. Puneet Bhojani, a gynecologist, and today we are going to talk about what can be done for prevention of breast and cervical cancer. Now breast cancer, as most of us are aware, is extremely common. It's the second most common cancer for ladies in India today. What all can be done for prevention of breast cancer? There are two aspects. One is the early prevention and second is early detection. For prevention, avoidance of smoking, because smoking definitely increases the risk of breast cancer, so we should avoid smoking and stop smoking. Again, alcohol is implicated in the etiology, so again alcohol should be avoided. Obesity, those who are obese and fat have got a more risk of development of breast cancer, so people should do regular exercises and maintain their weight in the normal range. So prevention of obesity. And breastfeeding, extremely important. People who the females who breastfeed their baby as long as possible, breastfeeding is thought to be prevention for breast cancer. The second part of it, so these are the things which will which can protect you, which we should do. And the second thing is for early detection. There's something called as breast self-examination. So that a lady starting at the age of 20 years, when a patient walks in my clinic, we teach them, and every female should regularly examine the breast every month to detect for any lump or any skin changes. So that is called as breast self-examination. We teach the patients. And second is mammography. But mammography is done for patients only about the age of 40 years, because below 40 years mammography is not useful. So breast self-examination starting from the age of 20 years. The female should do it every month, because a doctor can examine the breast only once in 6 months or once in a year. And mammography starting at the age of 40 years, every yearly to 2 yearly. If there's a strong family history of breast cancer, then these patients should meet the doctor early, so that the doctor can tell what all precautions and steps can be taken. So this is all about the breast cancer, which basic minimum information what the patient should be aware of. The second part, the cervical cancer, is the most common cancer for ladies in India today. Cervical cancer is number 1, breast cancer is number 2. Cervical cancer, we have got some shocking figures that every 7 to 8 minutes a lady dies in India because of cervical cancer. And again, this cancer can be prevented by doing two things. One is called as a pap smear test. It's a simple test done in our clinic. It takes a few minutes to do it. And this pap smear test should be done by, should every lady above the age of 21 years of age should undergo this pap smear at regular intervals till the age of 65 years. So every 2 to 3 yearly the pap smear test should be done. It just takes a few minutes to get it done. So ladies should get the pap smear done regularly. And very, very important, now there's a vaccination available. There's a vaccination which, if all females, the vaccination should be given to all females between 9 years to 45 years of age. And if a lady takes the vaccine, then 99.9% they would not get the cervical cancer. The vaccination is 3 injections, which you take it over a span of 6 months. It's very safe and there's no side effects of the vaccine. And patients basically between 9 years to 45 years should undergo vaccination. So there are simple tips which you should do for cervical cancer prevention: a regular pap smear checkup, and once in lifetime get 3 doses of vaccination done.